This video is going to be long, but if you can watch to the end of this video, you're going to learn from the mistake this farmer did. Different diseases can present a particular clinical sign. You can have up to 5 different diseases presenting a particular clinical sign. Okay. Now, if you now pick up one of those diseases, that one that you pick becomes your tentative diagnosis. Those ones, the remaining 4 that you did not pick, they become your differential diagnosis. I'm saying this because I had already given a tentative diagnosis on this case, and where I say that the birds were suffering from infectious laryngotracheitis because of the blood splash the farmer saw on the wall of the pen. But yesterday, I started brainstorming on the differential diagnosis. So I thought of one, that is thiamine deficiency, that is vitamin B1 deficiency, because this farmer had not given them multivitamin before. So that thiamine, animals get this thiamine from multivitamin because multivitamin contains it, but he had never given them thiamine. And this thiamine deficiency comes with this neck twisting. All right, the animal will just face the head upwards, a stargazing position. All right, and thiamine deficiency also comes with leg problem. So this is where he's telling me that the only abnormal physics he noticed is this whitish, watery, and pasty visits, but the other one beside it is looking greenish. So I now had to consider the other differential diagnosis, which is Newcastle disease, because in Newcastle disease you are going to see this neck twisting. We call it torticollis. You're going to see it there, and you're also going to see cough, and these birds were having cough. You're also going to see abnormality on the physics, and the physics that you're going to see is the type of physics you're going to see is greenish, watery physics. Okay, the physics will be greenish and not pasty. The greenish physics is not going to be pasty. It's going to be a little bit watery. So yesterday I asked him, in the last 5 days, how many birds did you lose? He told me that he lost only 2. I said, okay, if it were to be Newcastle disease, he would have lost more than 2 birds. And I asked him, have you ever vaccinated them against Newcastle disease? He said yes. He now decided, something that made him to decide to, he now opened up. Like he said, okay, let him tell me the truth. That on day 7, he vaccinated them against Gumboro. Then on day 14, they brought in birds from another farm and he introduced it to his flock. I think 2 birds. He said there were 2 birds. He introduced those 2 birds to his flock. Then the next day, being day 15, some of his birds started wearing coats. They became sick. Now on day 17, he started losing birds before day 17. So on day 17, the fear of losing bird now made him to vaccinate the birds against Newcastle disease. So he gave Lasota vaccine, and that is a wrong practice because he don't vaccinate a sick bird. Look at the birds that he was losing. Okay, this video was sent to me yesterday, this particular one where his birds, he started losing birds. So you don't vaccinate sick birds, and that is the mistake this farmer did. Vaccinating sick birds is simply, you're just worsening this the problem for the bird. You're just worsening the situation. Once you vaccinate a sick bird, it will make that bird to die the more, because vaccines are not drug. Vaccines are not given to animal so that a sick animal so that they will recover from their sickness. No, you only give vaccine to animals that are healthy. Okay, because there is a way this vaccine works. That will be a talk for another day. Now, for this whitish watery physics that you are seeing here, it is a sign of a bacterial infection. And one thing with viruses is that once they come, what they do is they will weaken the immune cells. Okay, the immune system, they weaken the immune system. The immune system is just a combination of cells, tissues, and organs that fight against diseases. Okay, now once this immune system is weakened, they will not be able to fight against diseases. Okay, that is when you now see bacteria, the animals will now be, or the individual will now come down with any type of infection, because the immune cells that fight against infection are already down. Now, how do you treat this Newcastle disease? Although we are taught in schools, or we are told in school, that the Newcastle disease doesn't have, in fact, viral infection doesn't have cure. There's no treatment for it. Okay, but we are not just going to fold our hands and watch our animals die. We have to do something. At least we already know that the birds will now come down with bacterial infection. At least we can give antibiotics because the immune cells are down. The immune cells that fight against bacteria or any infection, they are down. So we can just give antibiotics, right? And the immune cells are down. There are drugs you can give to the immune cells so that they will come alive again, so that you can revive them and they will start working. At least when I give those drugs, right? Now, if you have watched up to this moment, that means you have watched this video to the end. Just comment treatments in the comment section, or just ask me how are we going to treat against Newcastle disease. Then I will just list out the treatment regimen. You're welcome.